All right, everyone, I'm going to get started. It's 11:01. Hi, thank you for joining today's Health Effects Institute webinar on cumulative impact assessment. My name is Yasmin Romidi, and I am a staff scientist here at HEI. First, I'll just acknowledge my organizers at HEI and thank our speakers and moderators for joining us. Before I turn it over to the moderator and we delve into the webinar, I'm going to make a few housekeeping announcements. So all attendees are muted for the duration of the webinar. You can turn on closed captioning at the bottom of your screen on the right hand of the Q&A button. We're going to reserve questions for the 20-minute Q&A and panel discussion at the end, but you can submit your questions via the Q&A function at any time during the webinar. You can also upvote questions in the Q&A if you agree with something that's being asked. Also, if you experience any logistical difficulties, also contact us using the Q&A button. A quick little background about HEI and HEI Energy specifically. So HEI Energy is an independent nonprofit corporation chartered to provide policy relevant, high quality, and impartial science on the potential human population exposures and health effects from onshore development of oil and natural gas from shale and other unconventional resources across the US. So we're funded jointly by the government and the oil and natural gas industry, occasionally some private foundations. The way HEI Energy functions, and HEI functions this way as well, is to fund research that is selected, conducted, and overseen and reviewed independently of those sponsors. And so the energy program is overseen by the Energy Research Committee, which is comprised of internally recognized experts in one or more topics relevant to the research program. All right, so with that, I'm going to introduce our moderator, Dr. Julia Haggerty. She's an associate professor of geography in the Department of Earth Sciences at Montana State University, where she holds a joint appointment in the Montana Institute on Ecosystems. She also leads the Resources and Communities Research Group in studying the ways rural communities respond to shifting economic and policy trajectories, especially as they involve natural resources. Dr. Haggerty is a member of the HI Energy Research Committee, and she's also chairing the special panel that we have convened in support of this cumulative impact assessment design project, which you're going to hear a little bit more about from her in a few short moments. The other members of this special panel right now include Dr. Stephanie Mallon from Colorado State University. All right, so with that, I will disappear and you can take it away, Julia. I'll advance the slide for you.
Wonderful. Thanks, Yasmin. And just shout out to Yasmin for her amazing work organizing this webinar. And I want to just share a little bit with you about the overall project in which this webinar sits. So as Yasmin said, the Energy Research Program at HEI is spearheading the design of sort of an ideal type for a cumulative impact assessment process. And this is considering a representative community in the United States that hosts oil and gas extraction and production. So the purpose of the project is really to help support decision-making about how to best ensure the protection of public health. And the design of the project is overseen by the HEI Research Committee and a panel of external experts, including Dr. Stephanie Mallon. And ultimately, the design of the cumulative impact assessment kind of ideal type will be subject to review and discussion at a public workshop hosted by HEI. We intend that the cumulative impact assessment will focus on impacts that are most important for understanding how oil and gas operations influence the health and well-being of individuals, communities, and subpopulations within communities. We anticipate incorporating consideration of both chemical and non-chemical stressors from the built natural and social environments and how those stressors might benefit or adversely affect health. So today's webinar is the first in a multi-part series that's co-organized with HEI's Energy Justice Program, Environmental Justice Program, I should say, to inform how we can conceptualize this cumulative impact assessment design. Our initial webinar today will introduce the topic of what is cumulative impact assessment, why are cumulative impact assessments so valuable, and what steps have been taken to conduct these assessments. So we hope you'll enjoy this event and engage. And we're very excited first to welcome, I'm going to introduce each of the panelists in turn. And I'll introduce our first speaker, who is Beatriz Soto. Beatriz is an interdisciplinary artist, environmental activist, designer, and director of Protege at Conservation Colorado. Beatriz, you'll help me if I just butchered that. I apologize. I mean, no disrespect. She works as a leader at the intersection of community buildings and social justice and climate justice. Ms. Soto serves as commissioner on the state of Colorado's Environmental Justice Action Task Force, representing disproportionately impacted communities in Congressional District 3, and she co-chairs the Cumulative Equity Impact Analysis Working Group for the state. Beatriz, thank you so much for being here.
Thank you for having me, and I am going to share my screen. Can you see my screen okay? Because I can't.
Yes, it looks good. I can see that you're in that autoplay menu right now.
Okay, perfect. Well, thank you so much to HEI for putting this webinar together, and I'm very excited to present the Colorado Latino Climate Justice Policy Handbook, which is kind of a case study around the Latino community, specifically of cumulative impact of climate policy. And this is a bilingual community first policy handbook where we really wanted to make the information accessible and easy to read for community. Obviously, legislators and policymakers, scientists can also benefit from this type of work, but really our intent was to center community and how we presented the information. And the Latino community in a lot of policymaking, as we know, has never necessarily been central to who is designing the solutions, and having communities that don't have a lot of privilege, barriers to information, to language, to immigration status, all of this as well, the reality of the community creates the ecosystem for cumulative impacts of our decision making and oil and gas to have adverse effects. So at Protegete, we do a lot of advocacy with the Latino community as well to fight for the ability to have a healthy environment and the opportunity to thrive within the reality of our situation. And something that I like to mention a lot is that we say meet community where they are. And as we were thinking about this policy handbook, we were really thinking, well, where is community? So how we determined how we were going to compare communities is identifying what a high Latino county is. Now, the average Latino community in Colorado is 20%. So we were looking at communities that are above 25%, and we called those high Latino counties. And we can see that we weren't only focusing on high density areas, but we can see that a lot of rural communities actually tend to be disproportionately Latino. And then we mapped the state, and this is how we presented information because we want to make it visually appealing to community, is that we identified the areas in Colorado that are high Latino. So all the areas that you see here in the dark blue are above 25%, and the ones that are in a light blue are above 50%, and the ones in pink we considered isolated communities that have lack of political power. And we overlapped all of this map where we identified community where we have oil and gas, and we have brownfields, and we have all sorts of other industries that have adverse effects to community. And we could really start to identify visually where sacrifice zones are in the state of Colorado. And we can see that the majority of them are actually in high Latino counties. May they be urban, may they be rural, but those high pink areas are where we're seeing the most amount of climate pollution. Now, the other aspect that we really looked at as well is what are the social vulnerabilities of these communities? Which communities are highest in poverty, lack of education, lack of opportunities and resources, and also created maps to understand, well, where are those communities? And what we can see is these high red communities are some of the most vulnerable in the state of Colorado. And then from there, we can start to identify both, in maps, kind of how all of this is overlapping. What is really important for our community as well that we really looked at is that a high percentage of the population in these communities are actually children. So that is also, and then who is experiencing homelessness? And this is before we started to receive a whole bunch of refugees in the state of Colorado. So I'm sure these numbers are changing almost on a daily basis. But obviously, how children and what the cumulative impacts of pollution are on children is very different than adults. And that has a lifelong consequences. The other thing that we were also thinking of when you meet community where they're at, and we're thinking about policy, well, community is extremely overrepresent outdoor workers. So when we consider policies and when we consider policy solutions messaging, we also have to really think about, okay, well, this population is extremely infant. There's a lot of outdoor workforce. And another really important factor that we overlapped with all of this is water justice and water quality issues. What we found is that high Latino counties have a lot more oil and gas extraction in their communities, and all the consequences of oil and gas and what that industry really brings, is that also these communities have a lot more need to access water from wells versus having to access water from other sources of water. And these same communities in high Latino counties, 88% of water violations are in high Latino counties in the state of Colorado. So we have a cumulative amount of oil and gas extraction. We have most of the water violations happening in these same communities. These same communities have less access to nature and the benefits of our collective investments in infrastructure for outdoor equity, because we also look at the intersection of who is having access to a healthy environment and the infrastructure to be able to enjoy of that healthy environment. In the state of Colorado, we have a lot of pride of having a beautiful Rocky Mountains, some wonderful state parks, but then where are those areas, and are those areas balancing with oil and gas and industry at the same level? So when we have such a high population of children and families, we also realize that our community has less access to natural areas, and we have a higher concentration of children per park than we do in low Latino counties or communities that have a lot more privilege. So here we have this huge economic industry that is bringing favorable economic opportunities, apparently, right, to the state of Colorado. But even the benefits of the industry aren't being distributed equally into Latino communities. And what we're seeing is that high Latino counties have a lot less acres and twice as much children per park to be able to access the benefits that some of these industries claim to bring to communities. And then when we really run the numbers, that's not necessarily the case, especially in the state of Colorado. I also want to note that a lot of the research that we did specifically is based on the census, and that's where we have to grab information. Collecting the data is incredibly complicated. So community has a really hard time being able to access this data. You either have to pay for it, or we have to use the census tract that we know that can get politicized. And then we end up with the Latino community participating at an average of 5% less. So then even our data isn't quite accurate. The other thing is that the way that we're really seeing is like, how do we solve this, right? Because obviously when we present this information to community, it's so much more than just saying you're in a really bad situation, but then we also want to work with you to create solutions. And that's where we come in as making sure that people, policy, and politics are aligned to be able to create the ecosystem to create change for these communities and better livelihoods and everything from just transition. And the way that we've really thought about this and the way that we're partnering with community is making sure that we're creating ambassadors to be able to catalyze change. But then what we're also really thinking about is who is representing us, who is at the table, who is on boards and commissions and making decisions for community. And we have created a track to make sure that we are educating people from the community to be on boards and commission, and eventually, hopefully, decide to run for office or find themselves in a position where they can be a public servant to create this change, because the Latino community across the United States is underrepresented in boards and commissions in elected office. Despite being 20% of the community, we are 2% of any elected office, CEOs of industries. And it's very unfortunate, and we're all suffering the consequences of that leadership gap. And this is where, you know, we have leaders like Carla, that's on an image here, that she really fought for a testing program of water quality in mobile home parks. And she is one of the members that has been at the forefront of making sure that in areas where we have high oil and gas extraction, and then we're also having the consequences of more wildfires and bad air quality days, and then on top of that, bad water quality that is really impacting the lives of people. What does it mean for communities to be able to really tell a compelling story and connect how a housing insecurity, poverty is also connected to the consequences of living permanently with bad water quality. And then also really wanting to highlight one of the leaders that comes from our own community, which is Representative Velasco in House District 57, that is also a high oil and gas community that grew up in mobile home parks, and that can really start to understand, you know, from a lived experience, what cumulative impacts really mean from a social point of view as well, when part of her own career has been being a wildfire firefighter, working on interpretation, really coming from a community that has been at the intersection of all of these impacts. And then what does it mean as a legislator that is creating laws to think about cumulative impacts as well? So she was a great partner to work with us on water quality in mobile home parks, and then also starting to push for more testing in some of these communities. And I'm just going to close out with one of my favorite quotes, which is, "If you have come here to help me, you are wasting your time. But if you have come because your liberation is bound to mine, then let's work together." And this is really the modus operandi that we work with community is, you know, this is really about creating co-solutions with community, and making sure that we're centering community, especially in the face of cumulative impacts that intersect with social vulnerabilities, climate change, industry, economic injustice as well, and environmental justice.
Thank you so much, Beatrice. It's really tempting to just start talking now, because I think this is such a just such an inspiring set of actions that community is leading in Colorado, and this recognition and this challenge to us to think about always recognizing that community often has the answers, and that we need to follow and enable and empower them with their own solutions, is really just a great way to kick off this series. So I neglected to say to the audience that the format here is that each of our distinguished panelists will share their perspectives. We are taking Q&A through the Q&A function in Zoom, and our panelists are invited to respond to those in text if it is a factual thing. And if there are, you know, as we develop a list of questions, we will prioritize those in the Q&A that really help us leverage the expertise of all of our panelists. So I will turn now to introducing our next distinguished panelist, who is Dr. Rachel Morello-Frosch, an environmental health scientist and professor in the Department of Environmental Science, Policy and Management, and the School of Public Health at UC Berkeley. Dr. Morello-Frosch's research focuses on social determinants of environmental health disparities. Dr. Morello-Frosch, over to you. Thank you so much for being here.
Thank you. Can you hear me?
Sure can, and I can see your slides.
Excellent. Okay. So thanks for having me, and it's a pleasure to follow in the footsteps of Beatriz, because I think she sets the table really nicely for some of the things I'd like to cover to start our discussion. And one of the things that I like to talk about when we think about cumulative impacts, one is it's communities and environmental justice activists that have forced the science on environmental health and cumulative impacts to really think holistically about the combination of environmental and non-environmental stressors and their disproportionate impacts on marginalized communities, and both from a regulatory perspective and also from a research perspective. I like to conceptualize this in terms of thinking about environmental riskscapes, where we really need to think about the social context that includes legacies of social inequality and racism, segregation, and then how that plays out demographically, spatially, in terms of race, ethnicity, immigration status, class, wealth, etc. And so there's kind of three buckets that I think is important to think about when we think about the environmental justice implications of cumulative impacts. And on the far left, we think about disparities in exposures to environmental hazards, and that is defined holistically, whether we're talking about pollution sources, poor drinking water quality, lack of access to healthy foods, housing quality, et cetera. These are exposure factors, and these are things that I would consider to be extrinsic. These are things that we can change with policy and investments, things like that. And then there's social vulnerability factors, which is this bucket in the middle, another extrinsic factor. This is things like access to healthcare, wealth inequality, exposures to stressors, discrimination, and social inequality. And then on the far right are what I call biological susceptibility factors or intrinsic factors. These are things that we don't necessarily can easily change. These are things related to our sex assigned at birth, our ability to get pregnant or not get pregnant, underlying health conditions, genetic differences, age, et cetera, that make certain groups more vulnerable to exposures to both environmental and social stressors. These can combine and then drive what we all often talk about in terms of disparities in a variety of health outcomes in terms of disease and mortality. And this occurs also across the lifespan, both in utero and all the way until throughout the life course. And many of us have kind of written about this in terms of when we're thinking about cumulative impacts, the importance of thinking about both extrinsic and intrinsic factors when we're trying to both study the issue and then do something about it in terms of policy. So what we mean here is when we think about intrinsic and extrinsic factors, again, intrinsic being harder to change, these are related to things that, biological differences or underlying biological conditions like chronic health conditions, and extrinsic factors, things that really are changeable. These can increase disease risk when we think in a cumulative impacts framework. So if we look at the top line here, if we look at baseline risk, the folks in the gray have no adverse outcome, and then someone will have the adverse health outcome, whether that's chronic disease or an underlying health condition. And then if we look at baseline risk plus exposures to biological susceptibility factors, we will see that more people will be vulnerable and get sick on the right. And then if we combine that with the extrinsic factors, all of a sudden the distribution of people who are more vulnerable starts to increase, as you see on the bottom, the number of red people who are manifesting the clinical parameters begin to show up. So conceptually, that's what we need to be thinking about when we're thinking about cumulative impacts. How do the mix of both intrinsic and extrinsic factors combine to enhance the vulnerability of communities, particularly marginalized communities, to the adverse health effects of environmental hazard exposures, including exposures to oil and gas development activities? So this is the laundry list of what we think about when we think about environmental injustice. And I'm not going to read this to you, but studies and studies and studies, decades of work have definitely shown that marginalized groups, including people of color and the poor, are disproportionately exposed to a myriad of adverse environmental hazards, as well as the lack of enforcement of regulatory laws that are supposed to protect communities, et cetera. And this hasn't happened by accident. I think we need to acknowledge that legacies of discrimination and racism within the US and in terms of policymaking have led to situations. For example, when I show you this map, this is looking at indicator of racial residential segregation in US metropolitan areas across the country. And the places in red are considered to be hyper-segregated, where people of different races and ethnicities are very highly physically segregated from each other. And then in the yellow is considered to be more moderately segregated. And this has happened through many policies that have limited where different people can live in different neighborhoods. One of the examples that we often talk about is redlining, which was a policy that was implemented. It was actually to guide mortgage rescues in the wake of the Great Depression. The federal government mapped neighborhoods to decide where they were going to invest in neighborhoods to help rescue people from mortgage defaults. And one of the criteria for grading neighborhoods from A to D, D being colored red, i.e. redlining, was the racial makeup of the neighborhoods, the proportion of people of color, the proportion of immigrants, the proportion of working class people. This is an example of the notes taken about a neighborhood in Los Angeles that was redlined. And you can see a lot of the commentary and racist commentary that designated this neighborhood as a red line neighborhood. So why does this matter now? Well, there's been a proliferation of studies showing that the legacies of redlining that happened in the 1930s, over 80 years ago, are still exerting their impact on our physical environments today. This is true for oil and gas development. We recently did a study that showed that the distribution of oil and gas wells by the Homeowner Loan Corporation grades from A to D follows a dose-response relationship. If you look on the far left here, where the best graded neighborhoods, A, have the least number of wells, and the worst graded neighborhoods in places where there is oil and gas development are definitely going to have a lot more wells. This occurred before appraisal, but even a lot more after these maps, these Homeowner Loan Corporation maps were drawn. So this legacy, this discriminatory legacy around housing policy has exerted its impact in terms of where wells have been developed over the course of decades. And this matters for health because numerous studies, and I'm just highlighting some work that we've done in California, but there have been a lot of really good studies looking at the health implications of living near oil and gas development activities, particularly active oil and gas wells. We know, I study a lot of perinatal effects, that living near oil and gas development activities is associated with having a lower birth weight baby, a small for gestational age birth, an increased risk of preterm birth. And there are several studies that indicate that certain marginalized groups are likely to suffer worse effects of living near these oil and gas wells. For example, one study showed that Latinx pregnant people had stronger effects in terms of risk of preterm birth living near active oil and gas development. Rural populations often show stronger effects for these adverse health outcomes compared to their urban counterparts. So again, thinking about these social vulnerability factors and how they enhance the vulnerability of marginalized communities of the adverse health effects associated, for example, with oil and gas development. Again, legacies of redlining have also given their left their imprint on who's exposed to poor air quality. This is a study that was recently done by a graduate student in engineering at Berkeley, showing that if we look by the Homeowner Loan Corporation grade, again, A through D, this is looking at nitrogen dioxide or traffic-related air pollution, that you see a pretty strong dose-response relationship where air pollution is much worse for people who live in these formerly redlined neighborhoods. This is also true for PM 2.5. We also see a racialized gradient in terms of exposures to worse air quality, where communities of color tend to have worse air quality, regardless of whole grade, particularly for PM 2.5. This matters again when we look at the effects of air pollution on adverse birth outcomes. This is a study that we did a while back in California, where we're looking at the relationship of PM 2.5 and other forms of particulate matter, on decreases in birth weight in term births. And anything below 0 indicates a decrease in birth weight. And so we see that exposure, if we look at this panel in the middle, that average term birth weight decreased with higher levels of PM 2.5, but the effects were strongest here in the red here, were for African-American pregnant people in California. So it was bad for everybody, but particularly bad for African-American pregnant people in California. In another study, just to kind of bring home, if we flip the switch and look at what would happen in terms of benefits if we intervened and reduced air pollution, particularly in communities that are disproportionately impacted by worse air quality. This is a study that we did to look at hyperlocalized estimates of air pollution and its relationship with preeclampsia, which is a very serious condition during pregnancy. And we looked at black carbon, nitrogen dioxide, and ultrafine particles in downtown and West Oakland, California, where air quality tends to be worse because of proximity to a freeway and port. And what we wanted to see was, if we were to do an intervention and get everyone down to around the 25th percentile versus what they're actually experienced in terms of the exposures where they lived, how would the risk difference of preeclampsia decline? And we can see that these interventions reduce, for example, interventions to reduce NO2 result in significant decreases in the risk of preeclampsia, not a little less for black carbon and a little less for ultrafines. But if we stratify by the self-identified race and ethnicity of the pregnant people that we studied in these electronic health records, we see that the benefits of this hypothetical intervention of reducing levels of NO2, black carbon, and ultrafine particles is most dramatic for Black pregnant people. So again, when we think about cumulative impacts, not only documenting the problem, but if we take a cumulative impacts approach to hypothetical interventions to improving air quality, a little bit, as Beatriz said, if we're not just trying to help communities, we're trying to understand that our health and benefits are tightly intertwined, and that in order to address cumulative impacts and advance environmental justice is going to improve the health outcomes for everybody, and particularly for marginalized groups. And this has huge health equity implications and benefits for everybody. So in conclusion, these were just kind of highlights of what we mean when we think about cumulative impacts, what the science says, particularly in the realms of air pollution and in particular for oil and gas development. The science is going to take a while, but I think the preponderance of the evidence is there to really take action. And so I'm glad to see that HEI is moving in this direction. Communities, though, aren't going to wait until, nerdy scientists like myself sort out all the numbers and the statistical models. And so in the interim, there's been a lot of effort to develop community and data-driven tools to support and translate the emerging science into action. And this includes, using mapping tools, for example, CalEnviroscreen, even, Biden's Justice 40 initiative is trying to do some of that work. How do we target regulatory strategies and resources that integrate environmental health and sustainability goals with environmental justice goals to advance health equity and environmental justice? Thank you, and I look forward to our discussion.
Thank you so much. Such a rich presentation, and yeah, very, I would say, sobering as well. So I want to introduce now our final speaker, who is Dr. Jill Blakely, a professor in the Department of Geography and Planning at the University of Saskatchewan. So up in Canada, where impact assessment, I think, is a really great point of comparison. There's some really, there's been a lot of policy reform to try to improve impact assessment in Canada that I think we can learn from. Dr. Blakely's research focuses on cumulative effects assessment, or CEA, and strategic environmental assessment, particularly as applied in the case of regional scale natural resource development programs and mega projects. So turning it over to you, Dr. Blakely, thank you so much for being here.
Thank you so much for having me. This invitation is fantastic to have. And the two speakers ahead of me were like, wow, I'm blown away. I've learned so much already. I'll try to keep my comments a little bit briefer than I planned, just because of the timing that you wanted, and to leave enough time for questions following my comments. So again, my name is Jill Blakely. I'm with the University of Saskatchewan in central Canada. And I've been a consultant, an academic, and an author in the area of cumulative impact assessment for about 20 years. And I've done a lot of work to help develop international guidance for the International Association of Impact Assessment in the area of cumulative impacts. And I've also done a fair bit of work that has influenced our current federal legislation for impact assessment, et cetera. So I try to get involved in all aspects of the process. And I guess my comments are going to focus a little bit more on the nuts and bolts of the methodology and how this is practiced. So you wanted me to comment on the value of cumulative impact assessment. There's so much that can be said and that you've seen already, but I just want to highlight that cumulative impact assessment, the real true core value of doing that kind of exercise is that it does allow us to talk about the combined impacts of all projects. And that means in the past, also at the present, and potentially into the future. And that's a huge shift because we are looking at a combination of factors instead of limiting our discussions to the impacts of one project at a time, which is how it used to be done. So we can't take for granted the huge paradigm shift that cumulative impact assessment represents. And it's really gaining a ton of traction in Canada, the US, and around the world, especially in the last 20 years. And in terms of practical value, we really see that cumulative impact assessment has been a major catalyst for change in my country here in Canada. I'll just give you a few examples of the value that it has shown already. It's been used to get governments to pause or slow the pace of development in certain regions. It's been used as a basis to establish new legal precedents. In other words, lowering the bar on what constitutes an infringement on Indigenous treaty rights. It's been used to leverage massive federal funding and programs to establish huge new conservation areas in the north. It's been used to draw the attention of the United Nations to the decline of World Heritage sites impacted by oil and gas development. It's also been used to transform and upgrade regional planning processes across the country, and that's terrestrial and also with respect to marine environments. So the potential and the value is huge, and the importance of social impacts and cumulative impact assessment is only growing. So again, when cumulative impact assessment began some 50 odd years ago, it was really practiced as a technocratic, physical science-driven exercise, and it was sort of dominated by a small team of experts, usually. All of those were often either in-house for an industrial company, or they might be consultants hired by the company. But that has shifted over the ensuing decades, and today, it's really best practice to ensure that terms of reference for cumulative impact assessments are collaboratively defined through consultation with affected communities and nonprofits. And that is extremely important to scoping the exercise. Okay, so really what is assessed is starting to change because of that greater attention to social aspects and also involvement of communities. So in other words, when we involve the community, what we're getting is more attention to social indicators. So people care about knowing the effects to, for example, population growth rates, education attainment levels, self-assessed quality of life, equity in terms of distribution of benefits and disbenefits coming from the developments, and where the locus of control is, both throughout the impact assessment process, but also after in the implementation and follow-up phases. So the focal points of the studies are also changing as we integrate more social considerations. So now we see that cumulative impact assessments are not just evaluating impacts to, for example, keystone wildlife species, but also to elements like outdoor recreation opportunities, not just personal health, but well-being, and well-being being a much broader concept, and more can be more esoteric, but extremely important to someone's life path. We also see attention to evaluating impacts on community infrastructure and services. For example, are people able to access medical care in a prompt way, or other essential services? So we're just seeing a real shift in what is being assessed and how the assessment is happening. Data collection and significance evaluation are also changing. I'll just mention briefly, and these are all core aspects of a cumulative impact assessment process. So obviously, we're starting to include and pay more attention to qualitative data, to local and Indigenous knowledge, and to including subjective data, intuitive data, holistic data, spiritual data or observations or contributions, oral histories, and even we are looking at how to capture impacts to ways of life, or how to change that into some sort of a data point that can be measured and understood. Okay, so in terms of challenges and lessons, I was asked to comment on a few challenges and lessons. There are so many. I guess I can just say that in Canada, my research team has found more than 50 cumulative impact assessments that have been completed since the year 2000. Almost all of those adopt cumulative effects assessment as a real central core part of their focus. And each one of them is unique, meaning that there are so many relevant lessons that have been learned. And if you're wanting to do lesson transfer, it really depends upon the question that you have and the kind of impact assessment that you want to carry out. But more and more, there are lessons that we can learn from, and lessons that we can transfer. I would say perhaps one of the most important things, and this has already been demonstrated by the other two speakers, is that a key challenge and a key opportunity relates to helping people to understand and talk about and visualize stressors and effects. And so the more that we can make these impacts visual, the better it seems to work. People really respond well to interactive opportunities to contribute their knowledge, but also to see how things are changing across time and space. And we've had a number of our First Nations here in Canada create visual compendiums of landscape disturbance, for example, that have really gone a long way to affect the change that they were hoping to make. For example, one of the most important ones was the Blueberry River First Nation in northeastern British Columbia, and they made an atlas of cumulative landscape disturbance that showed that essentially their entire territory was heavily disturbed by not just oil and gas development, but also access roads, permanent roads, pipelines, seismic lines, and forestry cut blocks. So according to their analysis and their mapping, 84% of their territory is within 500 meters of an industrial disturbance. So again, this is sort of echoing the work that Rachel and Beatrice were talking about. Okay, so I think I'm going to stop it there just because I don't want to take up more time. I've been asked to, how can HEI construct a useful and impactful design for their process? And I do have some thoughts, but I can share them during questioning or after the webinar is complete. So thanks for listening.
Well, thanks so much to all of the panelists. So much expertise here. We are just beginning this conversation as an HEI focused initiative. So we cannot barely do justice to the richness of the expertise that is here, as well as in the audience, and so many good audience questions. So I want to encourage the audience to continue to use the Q&A function to submit questions. And they do vary from very targeted questions about particular presentations to more general questions. And building on that, I think what I'd like to do is just start a question with Dr. Blakely, and then I think there is an obvious place for Beatrice Soto to respond, and then Dr. Morello-Frosch. So Dr. Blakely, I want to just recognize that it would appear that there is some really positive things happening in the space around cumulative impact assessment in Canada, where it would appear there is a policy framework that allows for some flexibility in designing a cumulative impact assessment in ways that are sensitive to the differences in the riskscapes, to use the language of Dr. Morello-Frosch, that in each context for each project, there might be a different set of parameters that need to be considered. This has been a level of flexibility that's been quite difficult to incorporate into traditional impact assessment frameworks in the US. So I was wondering if you could speak a little bit about, like, what are we looking for in a policy environment that allows for that that flexibility in the design of the impact assessment, and then maybe turn it over to you, Beatrice, because I know you're actually working on implementing such a policy right now.
Well, ironically, the proliferation of practice and the extreme creativity that goes into all these cumulative impacts in Canada, the reason that we have that is actually not due to the federal or provincial legislation or regulations. It's because that legal framework is so restricted in terms of its scope that people are not waiting for government-driven opportunities or government-initiated opportunities for the most part. They're taking these matters and these assessments into their own hands. And so many of the most innovative and successful impact assessments in Canada are grassroots. And they are coming from partnerships created among scientists, sometimes interested industry, but also the affected communities, and so on. So yeah, so it's kind of ironic. It's because we don't have a lot of enabling legislation that then the creativity has had to emerge, because people really see the value.
I don't want to be in the middle of this, Beatrice. I'm sure you have some perspectives to add. Thank you for clarifying that, Jill.
Yeah, I would say in the state of Colorado, we have tried to be more of moving this through government and the cumulative impact analysis, because we have had communities and universities do studies, yet they're not recognized by the government. So community-based science is something that we put into the set of recommendations that the agency should work with communities. So the research that they're doing on their own through their own self-determination is actually valid and taken into consideration. We haven't gotten to that point, and it can get really contentious, and it's really heartbreaking when community does their own research and they find that there's radioactive on top of benzene and all of these other pollutants, and they're starting to see the cumulative, and they're living the cumulative impacts. And then, you know, a government agency says this isn't valid research, or we're not going to take this into consideration. So I think we're still in that contentious point and really starting to trying to change the laws, and that's something that we're doing in the state legislature right now. But there's also this bureaucracy and this complication of government agencies that a lot of times they're what regulates water and air and oil and gas permitting. They're all in different spaces. They don't speak to each other. They don't talk to each other. And then public health that does, you know, who has access to education and the infrastructure, the social infrastructure that you need to withstand these consequences. They're not all talking So then that's what we really tried to push for, is how do we modernize and how do we unsilo government so they're speaking to each other. And then when we're having a permit that will maybe be a transportation permit that's going to add more pollution to an area that has bad air quality because of other industry, is that the best place to put a highway? Right? So just starting to talk about this, because these agencies weren't speaking to each other, and that's I think what also created this scenario. I'm not going to say it's easy or it's going to be a smooth process, but that's what we're trying to establish, the foundation and the framework for government to make decisions, and local government that sometimes doesn't have the same amount of resources to understand all of this very scientific and technical information that maybe our state or federal agencies do have. So that's in a nutshell, that's what we're trying to achieve, to protect communities. And then under very simple determinants, which is a disproportionately impacted community, say if this is the community that falls under this definition, then it triggers that to start that motion. So first we have to identify and name what a disproportionately impacted community is to get the government to trigger that framework to go into that specific community.
Perhaps one of the biggest innovations that we've had in our federal legislation that could be helpful for you is that the 2019 Impact Assessment Act now has provision for regional impact assessments. So under the act, the federal minister can call for a regional impact assessment, and the results of that regional impact assessment do have to be taken into account by project proponents. And so these regional impact assessments, what we have is groups across the country lobbying for the minister to call for a regional impact assessment in these really intense natural resource development regions. And some have been successful. They're few and far between, which is why people still undertake these on their own. And I think that the other key difference for us in Canada is that we have a nation-to-nation relationship with our Indigenous people. And many of the most innovative, the most successful impact assessments that we see are spearheaded by Indigenous communities. And that has made all the difference, because when they do an impact assessment, our government, whether provincial or federal, they cannot dismiss that. They do have to take it into account, particularly in an area like BC, where the provincial government now has an act that essentially ratifies UNDRIP and the rights of Indigenous people to self-determine and to maintain, ability to have traditional practices and culture and so on. There's so much to learn across the border here.
Yeah, there is. And I'll just note that Canada's policy for impact assessment provides resources to communities that want to engage, which is also another major difference. So I want to turn to an audience question, and I'll direct this to you, Dr. Morello-Frosch, first. This comes from Sabrina Trask, and she asks, in a cumulative impact assessment, how do you assign values to disparate things such as tons per year of nitric oxide, which could be modeled and measured, versus less tangible, measurable impacts or benefits like creating new green space in a community? Is there a reasonable and consistent method to weigh the balance between adverse and beneficial impacts?
Yeah, that's a great question. I think my experience has been that I live in a pretty data-rich state, and the effort has been to develop and literally decision-making tools and leverage administrative data sets to look at the concentration of stressors, environmental and social and otherwise, and then also lack of benefits, i.e. things like green space. And to look at those in buckets, if you will, so that you can sort of peel the onion and focus on things. For example, if a certain agency has jurisdiction over a particular set of issues, they can focus on those data elements. But then you can roll it up and do sort of a relative comparison in terms of cumulative impacts to try and identify communities or regions that are disproportionately impacted by social and environmental stressors, and also less likely to have access to certain kinds of benefits or amenities, again, like green space or, and so and we have consciously made an effort not to weight those, because they're very different, and there's not, good guidance and in the scientific literature about how you would weight those, and communities might weight those differently depending on the issues that they're facing. I think the other key with these sort of law, for example, California has what's called CalEnviroScreen, and I was going to chat it, but I'm not quite sure where to do that. And I think the key of the power of those tools is it can identify communities that may not be organized or have civic engagement capacity to the extent that they can be heard by government agencies, and yet who may be disproportionately impacted and require regulatory attention. And then I think the other key of these tools, both in terms of amenities and hazards, is you want to make them nimble enough so that you can also benefit from localized cumulative impacts and data gathering that have occurred at these local scales, at community scales, in indigenous communities, because that on the ground data is extremely important as well. It may not be available statewide, but that's really critically important information to decide what kind of regulatory attention a community needs, or what kinds of investments and resources and environmental improvements we want to make.
Thank you. I'm gonna maybe try to take one or two more questions from the audience and just acknowledge like what a rich set of questions from the audience. We're so glad you're here. Really want to keep you part of this conversation. And I think the question that I would take next, I'm going to try to kind of combine two, and I'm going to turn it to you, Beatrice. Two different audience members are just thinking about like this issue of how do communities keep government listening. So one question is, government gets tripped up by specific terminology, like words like liberate or disparate. What can communities do to keep government listening? And another audience member asks, what can we do to be part of moving cumulative impacts work forward to create positive policy change? So I wonder if you want to reflect on your experience relative to those questions.
I mean, to get government to listen, we have to get community to participate, right? I think that's and that is also extremely complicated, because when you have communities that have historically been disenfranchised or are suffering with a lot of the intersection of a lot of issues, may it be the availability of time, education, transportation, it doesn't allow civic engagement. It doesn't allow participation. So that's why I think it's so important for us to not silo ourselves in our issues, and really start to look at the broader reality of society and how we get to these circumstances where community does not participate or does not have the ability, right? That's by design. That's by human design. That does not happen because community does not want to participate. They simply cannot. A single mother of three with that does not have access to transportation, stable housing, it will be almost impossible for her to have any type of civic engagement. So I think that's where we kind of like step out of our realm a little bit of just environmental policy into other issues as well, and help build coalitions across multiple issues, and making sure that community is understanding what the factor of the environment fits in with all the other issues that they are confronting as well. And then what was your second question? Sorry.
I mean, I think related of just like what can community do to move this forward, to move cumulative impact assessment, practice forward.
This is really a big effort amongst community, government, universities, civic society, right, to really move the way that we've done things in the past into a very different type of systems thinking and human-centered design of like, how do we design processes that are common sense, that are easy to understand? How do we start to look at the impacts depending on do people have access to healthcare? Can people really withstand pollution, right? What does that really mean to their everyday life? And in a practical sense, how does this really impact people versus in this very etherical or assuming that we're designing things outside of reality? So I think that's where this broader systems thinking really has to start to take approach. Where we can really start to create those changes. And it's fascinating, but communities sometimes have the best, most brilliant ideas, and we're not thinking with them. We're thinking outside of them and creating solutions outside of what community really wants. And community sometimes can be extremely practical and low cost. And then there's also the sense of investment in their own well-being and their own health and their own future.
Okay, well, I know we could have such a rich conversation that could continue all morning, but we need to honor the time and let our experts go on to just doing the wonderful change that they're making in the world. So thank you so much to our speakers for being here today. Thank you to the HEI staff for organizing this webinar. And most of all, thanks to this audience, I can tell from the questions that keep coming in that there is a huge amount of interest in this topic. So we want to encourage a few things. Definitely, there'll be a feedback survey linked in the chat, and there'll be a follow-up email to all attendees. If you're not on the mailing list for these HEI Energy webinars, you can go to the website to get added to that mailing list. We'll keep track of all these questions that have come in, and we'll do our best to reflect them in the ongoing work, which was something people asked about. So this is a year-long project at HEI. It consists of multiple webinars and then staff effort to compile all of what we've learned into a suggested cumulative impact assessment framework specific to oil and gas and specific to the sort of emerging policy context in the US. So we very much hope you'll join us for the next webinar in this series, which will be held at the end of March. And in that webinar series, we'll be highlighting some more specific examples of cumulative impact assessment with a focus on how different scales and jurisdictions, local, state, and federal, might interact in that space. So thank you so much for being here. Thank you again to our panelists, and we look forward to seeing you at the next webinar.